Welcome to the Affirming Minds podcast, where we equip like-minded mental health professionals with a therapeutic toolkit that helps add to a more engaging, fulfilled, and effective mental health practice. Each empowering episode can stand alone as a continuing education pod course or a very valuable professional or personal resource with insightful expert interviews, practical resources, industry news, and lots of inspiration. We help the modern therapist thrive at work. Now let's welcome your host, a dedicated therapist and passionate educator, Shaina Siber, LCSW.
Welcome to the Affirming Minds podcast. I'm your host, Shaina Siber. Before we dive into today's episode, I want to take a moment to share some important disclaimers. This podcast is for educational purposes only and should not be considered a substitute for professional treatment or clinical supervision. If you're in need of those services, please reach out to a licensed mental health professional. Confidentiality is always a priority. Any clinical examples shared in this episode are de-identified, composites, or clinical vignettes, ensuring that no real client or patient health information is ever disclosed. If you're interested in earning continuing education credits for listening to today's episode, visit affirmmentalhealth.com to learn more about our membership options. Our membership includes CEs for live virtual workshops, self-study webinars, and pod courses via the Affirming Minds podcast. Today, we're diving into an emerging and transformative area of mental health care, the integration of acceptance and commitment therapy, ACT, with psychedelic-assisted therapy. ACT is an evidence-based, process-driven therapy that helps clients cultivate psychological flexibility, the ability to stay open, present, and engaged in value-based actions, even in the face of difficult thoughts and emotions. Instead of trying to eliminate distressing experience, ACT teaches clients how to shift their relationship to suffering, helping them live fuller, more meaningful lives. Psychedelic-assisted therapy is a rapidly growing field that involves the controlled therapeutic use of psychoactive substances to help individuals process trauma, depression, and other mental health conditions in guided, safe settings. Two main substances we'll be discussing today are MDMA, a synthetic psychoactive substance that enhances emotional processing, empathy, and connection by increasing serotonin, dopamine, and oxytocin levels. MDMA-assisted therapy has been shown to be highly effective for treatment-resistant PTSD as it helps reduce fear responses, increase emotional openness, and facilitate deeper therapeutic work. Next is psilocybin, a naturally occurring psychedelic compound found in certain species of mushrooms. Psilocybin interacts with serotonin receptors to produce altered states of consciousness, enhanced interoception, and profound shifts in perception. Psilocybin-assisted therapy has been studied for its effectiveness in treating major depressive disorder, existential distress, and anxiety, often leading to insights that support long-term psychological growth and healing. Both MDMA and psilocybin are not standalone treatments. They are used in structured therapeutic settings with trained professionals to support emotional processing, insight, and healing. I'm honored to welcome two leading experts in the field. Miranda Morris, LCSW-C, is a co-founder of True North Therapy and Training, specializing in ACT and psychedelic harm reduction and integration therapy. She provides training, clinical supervision, and consultation in both modalities. Temple is also a consultant therapist at Sunstone Therapy, where she delivers MDMA and psilocybin-assisted therapy to support participants with treatment-resistant PTSD and major depression. She co-founded Psychedelic-Assisted Therapy and Healing, a nonprofit dedicated to making legal psychedelic therapy accessible and affordable, where she serves as a board president. Additionally, she is co-chair of the ACBS Psychedelic Special Interest Group, where she co-leads ACT and Forum PHRI peer consultant groups. Miranda Morris, PhD, is a psychologist, peer-reviewed ACT trainer, and past president of the Association for Contextual Behavioral Sciences. She regularly conducts workshops on ACT, functional analysis psychotherapy, and relational frame theory. She is also founder of True North Therapy and Training, dedicated to sharing contextual behavioral therapies with clients and practitioners. Miranda remains actively involved in the Mid-Atlantic chapter of ACBS and its ACT Carolinas affiliate, contributing to training and peer consultation initiatives. Both Temple and Miranda bring a wealth of knowledge and experience into this space, and I'm thrilled that we have them on the show today. Miranda Temple, thank you so much for joining me today on the Affirming Minds podcast. I cannot wait to get into this conversation. It's an area I have so much curiosity about, and I'm really coming in with a beginner mind myself in a lot of ways. Can maybe we just start by you introducing yourselves to our audience and sharing how you came to work in the field of psychedelic assisted therapy?
Absolutely.
Yeah. Thank you for having us, Shaina. We love talking about this stuff, especially in the context of ACT and CBS. I know that your listeners have some familiarity with our bios, so I'll speak to stuff that I think is probably not in our bios, which is that we are twin sisters, both therapists, and we share a private practice along with our partner, Evan Merks, in Bethesda, Maryland, just outside of DC, where we practice CBS modalities. We also offer training and consultation and supervision. In terms of our interest in psychedelics, I think that began a little under a decade ago when I had my first experience with psychedelics as an adult. I'm not counting college, but my first sort of therapeutic experience of psychedelics as an adult. And it was really powerful and transformative for me. And I got a little evangelical about it. And I told my sister she was going to have to do it too. And she'd already been thinking about it. So then participated in a retreat organized by the Psychedelic-Sig of ACBS. Miranda was one of the organizers. I don't know how many years ago this was. Not that many, like 6, I think.
About that.
And it was there that we both first experienced psilocybin and connected with other people in ACBS who were really committed to understanding psychedelics from an ACT perspective and creating a home for psychedelics in the CBS community. Because the truth of the matter is that there weren't very many of us then, and there still aren't very many of us. But that was a turning point, I think, for us and for our friends and colleagues with whom we became much closer as a result of that retreat. So I think that's what got us started. Miranda, what would you add to that?
Just add that since then, it feels very mission driven, and other contextual behavioral approaches are very science-based. And there's some really interesting science happening in the psychedelic space, and marrying the two and disseminating from that place feels really important to both of us. And so we have continued along trying to learn as much as possible, share with others, and most recently trying to help others have experiences of inside out experiences of psilocybin, as well as experiences sitting with people who are using psilocybin or journeying on psilocybin, which is its own kind of remarkable, I dare say, trippy experience.
Yeah, I love that. And I honestly, what I really find powerful is when anybody comes to their work with through some sort of lived experience and just hearing that there was this transformative element and just wanting to share that and disseminate it and have that impact other people and it coming from that place is wonderful. And I am also really curious to hear more about the science behind it because clearly the ways that you're creating a therapeutic process seems to be so impactful. Can you tell me about what you are creating through perspective retreats and how does it prepare therapists to support clients in psychedelic assisted experiences?
I'm going to say a little bit because Temple is really ahead of me in the psychedelics space. And so she'll probably get the juicy stuff. So Perspective Treats is a company we started just over a year ago, and we are comprised of 5 psychedelics therapists: Temple, myself, Brian Pilecki, Jason Luoma, and Jenna Lejeune. And what we have created is a retreat experience in the Netherlands where psilocybin is legal. It can be legally used. And these retreats are designed for therapists, and they are designed to give people an experience of actually using psilocybin, which can be really scary. I mean, Temple mentioned that when we came to this, we were older. I was 48 years old the first time that I used psilocybin. I was not playing around. it can be scary. And we wanted to create a context in which people could feel certain that they were looked after, right? And that they were being tended to by people who are experienced facilitators in the field. So we wanted to create that. And the hope, sort of the extension of that, is that people will use their experiences from the inside out, as well as sitters, to go ahead and perhaps apply those skills in contexts where it is legal to do so, as things seem to be moving in that direction. Temple, you want to add anything to that?
I think that pretty well sums it up. Part of our mission, too, as I mentioned before, is to create a space for psychedelics and ACDS. And so what Miranda mentioned briefly is that when people participate in our retreats, they have the opportunity to dose psilocybin 2 times, but they also have the opportunity to sit for other participants who are dosing. And we feel like that's a really critical part of the training. And I think it's a surprisingly powerful experience that people don't see coming. I think that there is the value in that group shared experience of taking care of each other and holding space for each other when people are very vulnerable. That is not what we ordinarily get to do in the 50-minute hour.
Yeah.
So we're especially excited about that part. And we think it's an important piece for people who are interested in working in the space, but don't really know. Do I want to do this? Do I want to sit for someone for 6 hours? Is it too weird? What if they act crazy? I think this is a really valuable, helpful opportunity to determine that.
Yeah.
On top of getting to have the opportunity to dose in a safe setting, literally surrounded by therapists.
Yeah. To me, I hear there's such a intention about creating safety in that environment and being so sensitive to the vulnerability that this can position someone to be having. And it sounds like having, I love that languaging that you both are harkening back to, that inside out transformation, and how crucial creating that space and setting seems to be in that process, and inviting people in and seeing if they want this to be part of their world. And I imagine many people that do take that journey and participates in these retreats, I'm curious how they wind up integrating this into their work. And we'll talk more about that, getting ahead of myself as usual when I get excited. So going back to the science, can you give me an overview of the current research on MDMA and psilocybin-assisted therapy for treatment-resistant PTSD or major depressive disorder?
Sure. I'll start with MDMA. MDMA has probably the most robust empirical base to support its efficacy. Most of that research has been on folks with PTSD, usually complex PTSD. I think the average length of symptoms was about 14 years. So that research has been done on people with especially treatment-resistant PTSD. And the outcomes have been really promising. About 68%, this is in the phase 3 clinical trials, about 68% of participants lost their PTSD diagnosis. And that was measured at about 2 months out from the treatment. So that it had an enduring benefit, and they continued to do well at a year. About 88% had a reduction. So even people who didn't completely lose their PTSD diagnosis, they did see a reduction in symptoms, and those are really impressive numbers, especially considering that we don't really have any pharmaceuticals that are effective at treating PTSD. I would highlight that most of these folks also had multiple traumas and a lot of comorbidities, suicidality, dissociation. It's not an uncomplicated population that MAPS, the organization, the sponsor of these studies, took on. Psilocybin probably has, they're more empirical. There are more studies of psilocybin than there are of MDMA, and a little bit more, I think, variability in outcomes, but generally speaking, the outcomes are very positive. We see reductions in depression and anxiety and increases in personality traits like openness and acceptance, nature relatedness, prosocial behaviors, mindfulness. So we see a range of beneficial effects that are enduring for as long as a year out. That's what we've measured thus far. And I'll say that this research around psychedelics, these two medicines and the others, is really in its nascence, right? This is really just the beginning. The trials have not involved that many people. I think in total, there have been 1,700 participants in the MDMA trials, which is still pretty good. And we need to, I think, be mindful of the fact that the numbers are relatively small and that there are methodological weaknesses to the research. I think primary among them is that you can't really blind a psychedelic study, right? People know what they're getting. So we are running double-blind, randomized controlled trials, and people are pretty sure that they know. The study sponsors are working very hard to blind, but it's difficult. You can't really compare with psilocybin for strong subjective effects. So that's one of the concerns. I think another concern in reading the research, or another consideration, is that the inclusion and exclusion criteria for study participants are very strict. So we're seeing a narrower slice of the population. And once these medicines hopefully become available in clinical settings, they will be used with a much broader sample. And so we don't know what that's going to look like in the wild, so to speak. I think that the results will be less impressive, and we don't know yet.
It's very interesting to hear about the promise that the existing research shows, but also, as you mentioned, as hopefully there's a broader application, how is that translating? But again, so nice to hear that for complex PTSD, there's these enduring impacts, right? Because I think for a lot of people coming out of this space, thinking about the integration of these sorts of interventions, perhaps some of the bias or some of the presumption would be people are having these transient experiences while they're under the influence, and how is that really carrying forward? I think that is really an important piece to highlight, that 1 year out, that there's these enduring effects on well-being. Would you maybe be able to talk us through a bit about what this process of psychedelic-assisted therapy looks like from start to finish? And I know in stateside, a lot of this is happening in the context of clinical trials, so that may not translate exactly how it would look in clinical practice and the way it's being delivered in retreats and other areas where the regulation would support these treatments more openly. But can you give me an idea of what the patient experience may be?
Sure. So there are hundreds of clinical trials running even as we speak. And so if someone applies for a clinical trial, let's say they reach out to a facility that's running these trials and apply to be a participant, there's pretty strict screening from the get-go. And every trial has different screening criteria. Frequently, people are screened out for things like recent psychedelic use, active suicidality, sometimes first-degree relatives with bipolar 1 disorder or psychotic disorders, even for things like inadequate social support. The trials get to be pretty choosy about the applicants that they accept. But once somebody makes it through the screening process, they then begin the preparation process. And that's between 1 and 3 preparation sessions, generally speaking, sometimes with 2 therapists, sometimes with 1 therapist. Much of the focus there is on really familiarizing people with the space, with the subjective effects of the medicine, with what they might expect during the journey, and really establishing safety and rapport with the therapist. I think that is, for most of the trials, that's what we're emphasizing, is a sense of safeness and that relationship, which we think is just so critical, because we don't have a lot of time together to do that prep work. It is surprisingly powerful by the time we begin. People, generally speaking, are really ready to lean into the process and to connect with the therapist. Once we've done prep, then again, depending on the protocol, there could be between 1 and 3 dosing sessions. In some of those studies, you might get placebo or a really low dose. Most of the studies now have a design, or many of the studies now have a design where if you do get placebo, you'll be eligible for an open label readministration later on, meaning you'll definitely get the drug, which I think is a really ethical and important study design. So you do your 1 to 3 dosings, and between dosings, there's integration support. So usually 1, sometimes more sessions of discussing what happened in the trip, what felt important, what do you want to take away from this? And then at the conclusion of the dosing sessions, usually there's some integration sessions there as well, where I think different modalities emphasize different pieces. I know as an ACT clinician, what I'm really emphasizing is how do you want to carry this forward? What's that going to look like? How do you want to weave that into your behavior? Because unfortunately, a lot of people come into the trials and they've been captured by the hype around psychedelics. I think the message that a lot of people receive is, oh, this is a silver bullet. Like I read about that lady who took psychedelics and she never wanted to smoke again. And they think, oh, this is great. So it's going to fix me. And I think that comes out of mental health, right? And out of psychopharmacology, like the pill is going to fix you. And what we want to emphasize in prep and in integration is that's not how it works. These medicines can open the door to change, but we have to walk through the door. We have to meet the medicine, so to speak, and keep doing the work. So that's an important component of integration, certainly from where I sit.
Yeah, absolutely. And I know we're going to really talk specifically about ACT integration, but I think for me, just hearing about the meaning making piece being so critical and like discerning the values that are in there. And I think that mapping so well onto an ACT framework of depathologizing and saying this is not about fixing your brokenness and really staging it in a way which is based on having this deeply purposeful experience to have more engaged living. I could understand why the therapeutic relationship is so critical, because that seems like without that component, a lot of the therapeutic value could be lost. It's really how these pieces of it come together in the process of the treatment. Yeah, that's fascinating to hear about what that looks like for folks undergoing this treatment who are interested. I know we're starting to maybe talk about just like how critical it is to establish this safety. Could we maybe talk a bit more explicitly about the role of setting and how that supports creating a safe therapeutic environment for individuals that are getting psychedelic assisted therapy?
Miranda, do you want to speak to that?
I'll say a little bit about it. I think the psychedelic experience is unusual, to say the least. And so having as much certainty and security around you as possible, right? I think that what we achieve when we do that is we undermine additional doubt and worry that people might be going into a trip with, right? I'm right here with you. I've got water. If you need to use the restroom, you will be cared for is an important foundation in reducing the kind of the understandable, but maybe sometimes beyond what is necessary, kind of concern about what it's going to be like to, in many instances, relinquish control. Yeah, right. Ugh, so that's a pretty frightening thing, particularly when it's novel and you don't know what it means to relinquish control in the way that happens inside of a psychedelic experience. So the hope is that it really optimizes people's ability to be open to whatever shows up, whether it's an emotion or a thought or a feeling or something visual or sensory, to be open to it, to be willing to experience it, to move through it, whether it is something that you might ordinarily want or not want, so that you can derive maximum benefit from the experience.
Absolutely. Is there anything that when these trials are conducted or when you're doing your treat, you're thinking about specifically in terms of creating that setting? Is it certain like textures or like a neutrality of the colors, or is it like being in certain idyllic environments that support it or would be contraindicated in establishing that? Or is it more about like the relational building of that is inherent to create a setting?
I think the aesthetics are so important. And Temple, you said something really cool about this once. What was that?
Yeah. Tripping people need order and beauty. So like when we run our retreats, I feel really strongly about making sure that the environment it's already a beautiful center where we host these retreats, but it's like clutter must be gone.
Mhm.
Flowers must be on the table. I think beauty and order are really important. And in the clinical trials, we pay attention to that as well. And where I work, we have really beautiful treatment rooms and we dim the lights and there's music playing in the room, also in the headphones that people are wearing. We often have flowers and we make a little snack plate at the end, a little board of grapes and charcuterie for people, which has been described by more than one participant as this is just like room service. We really want to create an environment that is calming and relaxing and dim, that shuts out extraneous distractors, and it's attractive. I think a pretty space matters. Outdoors would be ideal. You don't have to do much to get the outdoors ready for this kind of thing, but the clinical trials are run inside.
Yeah.
Happily at our retreat, we get to take people outside, which is a bonus.
Yeah, it sounds lovely, really.
Mhm.
It sounds, and I do like that you know, creating an aesthetic that sort of prioritizes beauty and structure makes a lot of sense for grounding people in this experience. Can you discuss a little bit about how therapists are trained to participate in these sorts of clinical interventions? What kind of skills that need to be developed to be prepared for this kind of work and supporting clients through these journeys?
I think generally speaking, it depends on what setting you're working in. If you want to go work for a retreat center or if you're interested in being a clinical investigator on a trial, it's going to depend. My general sense is that what is sought in therapists who they'd like to include on the team are folks who can handle a lot of emotions, right? Therapists who are not scared of a lot of emoting, a lot of vocalizing, a lot of intensity. I do happen to think that ACT therapists are particularly well trained for that, since very often that's what we're trying to evoke. But also folks with a good bit of trauma experience that is valued, because even when we're working with folks who have MDD, it's not unusual for there to be a trauma history. So familiarity with trauma-informed care is important. Those are the two that come to mind. Miranda, you think, are there other qualities that folks are looking for when making this determination?
I think like folks who are bringing therapists into these clinical settings or just thinking about what one needs in order to undertake to do this. I want to amplify what Temple said about people who are willing to really show up fully to big emotions and to unusual experiences.
Yeah.
Right? There are a lot of really out of the ordinary ways that I think trips represent what's happening for people, or that people talk about what's happening in their trips. And so that's actually part of why I think the inside out experience is valuable. It is hard to make sense of what a tripping person is communicating, should they choose to communicate, if you haven't any idea what it's like to be in such an unusual, really inexplicable space. Even though every trip is different, just having contacted inexplicable is really helpful for just saying, yes, of course, so that you can be part of keeping things moving along. And I think in general, I think it's helpful for therapists to trust in people's ability to navigate these inside experiences, even when they're challenging, to trust the experiences that come up and to trust that there will be something worthwhile or valuable, even if they're painful or challenging.
Yeah.
We have to bring our own courage to our clients' experiences.
Yeah, absolutely. And I think that's really interesting, almost like translating someone who's experiencing a trip. And then if you've had that experience yourself, that just a way of to have a touchstone that perhaps someone who hadn't had that experience feel a little bit more disconnected to. So it sounds like for individuals that are interested in doing this work, that thinking about the retreats and thinking about participating in a retreat might be a really helpful entry point in your experience.
Mhm.
Can you tell me a bit more about psychedelic harm reduction and integration therapy support for
Yes.
clients and what that looks like before, during, after in terms of their experience with psychedelics?
So that's what we practice in our private practice. And it's what most clinicians in private practice who are working in the psychedelic space are doing. They're working before somebody, or when somebody's first considering psychedelics, that's when we would apply the principles of harm reductions, helping our clients figure out, is this the right choice for you? How do we reduce risk? How do we enhance benefit? How do we honor your autonomy and your agency? So that would be the harm reduction piece. When the client, if the client decides, yeah, I think I want to go ahead with this, then we would move into helping them figure out, okay, how are you going to do this? What does that look like? So you found an underground guide. Do you know that's illegal in this state? What are some ways that we can assess that you might be able to assess this person? What's some research that I can point you to or that you might be able to undertake? And really considering down to tiny details, things like, where are you going to be? Will it be possible for you to go outside if you don't like the inside? Will you be able to control the music yourself? Have you selected a playlist? Do you need help selecting a playlist? Will you be on your menstrual cycle? And might that have an effect? And would it make sense maybe to wait until after that's passed, depending on how people experience that? So really getting into the nitty-gritty details of figuring out how can we help you create a setting that is as safe as possible, whether you're at a retreat that is legal in the Netherlands or working with an underground guide or flying to Oregon to work with a facilitator there. Preparation just as important. I mean, we're talking about setting here, right? How do we help them make sure that the setting is safe? Just as important is helping them prepare their mindset. What attitude do you want to bring to this journey? What values do you want to bring to this journey? I think very often, and again, this is ACT informed, right? So this is our perspective. I can't speak to other modalities. What feels really important to us is not taking that passive approach to the psychedelic, setting an intention like, I want to be rid of anxiety. I think we know in the ACT community that intention is going to backfire.
Yeah.
And so when Miranda and I are working with folks around preparation, what we're inviting them to think about is, how do you want to meet the medicine? What are the values that you want to bring? Curiosity, openness, willingness, courage, so that it is our aim in part to promote a sense of agency in a space where you might not have a whole lot of agency, but also a sense of accountability and responsibility. When we're looking at the journey, like, it's a team effort here. It's the client, it's the medicine, it's the therapist, it might be the guide. We're all working together and hopefully amplifying each other's beneficial impacts.
Mhm. I think that initial, it's psychoeducational, right? Like how, like, sure you have water, dress properly, but also to help people get clarity on how to go into the trip, because lots of people really do want this is going to make my anxiety go away, or now I won't be afraid of death because I'm going to talk to God, right? And people often have goals in mind instead of ways of moving through the trip, right? What in ACT we think of as values, or sometimes I think that kind of gets mixed up along with intentions. We want people to navigate the trip as skillfully as they can and in a way that gets them the most out of the trip. We also want to disabuse them of the notion that this is going to make anything go away. Right now, I won't miss my beloved grandmother anymore. No, you will probably still have that. at the end. We're not trying to
Mhm.
get rid of anything. We're not trying to delete. We're trying to open up
Expand. Yeah.
experience and then integrate it into your actual day-to-day life,
Yeah.
which is this whole other piece.
Yeah. So when we're talking as part of preparation, we talk about intention too. As inviting people to think about intention as what do you want to focus on? What do you want to learn more about? What do you want to be open to or curious about? Rather than making a demand of the medicine, because the medicine doesn't respond well to demands. And often they'll say very often in the psychedelics community, folks say the medicine might not give you what you want, it will give you what you need. And that has been my experience. I've seen people move into the medicine determined, I'm going to get in there, I'm going to resolve this grief. And they're in there and they're like trying to grieve and it doesn't work. And if they can let go and surrender and be willing to have whatever they have, they end up doing really valuable work. Maybe just not on that grief. Maybe that's for another time.
I
So
think
that's the prep.
yeah, no, that's really, and it sounds so much about like how to maximize the experience while like debunking maybe like rigid expectations that are more about elimination of these unwanted internal private experiences. It's really interesting the way that it sounds like that act work is getting so woven into it. And also just, I think it was really interesting for me to hear because I did have a lot of curiosity about dissemination. As you mentioned, that a lot of these retreats they're happening abroad. And then the inclusion criteria for the clinical trial seems like quite narrow. So for individuals that are curious about this and might have decided this is something and they're going to seek out if they're living in the States and don't have access to participate in such a trial, it sounds like there's still this framework to, if that's their decision, support them safely and give them the best opportunity to have therapeutic value in that experience if they're seeking out access to whether it be these psychedelic therapies through other means.
Yeah. And I would add that there's, and I don't think this is always obvious to the folks who contact us and who anticipate doing psychedelics on their own, but would like to do harm reduction and prep and subsequently integration, is they often don't really have a sense of the different ways, the different experiences that come depending on how you use the medicine. If you take some psychedelics and go to a music concert, that's a very different experience than being with a safe sitter with eyes closed or a mask on and a thoughtful playlist and safety and wraparound support. Both experiences are lovely. I don't need to dismiss the music concert application, but people may need help in figuring out how to get that kind of experience. It's just not obvious from what's available to most lay people. So guidance around that can be important as well.
Yeah, and I think that's such a good point because I think a lot of people, like again, outside of really understanding the therapeutic value and discerning that it's not just the psychedelics themselves. I'm sure there's like tons of people that have recreationally taken MDMA that have, like you said, a lovely time, a great experience, a great night, and didn't have therapeutic value or did not an impact for anything they may be suffering in a more enduring way. So this is really helping me solidify that understanding of the therapeutic work and leveraging these psychedelics for value versus just like it inherently, like you said, it's not a silver bullet. It's the process and context in which these medicines are being used to help them heal and help them expand. So I know you both have started to speak to how ACT is integral in the way that you are delivering these treatments. Anything else that would be important for our listeners to hear about how ACT principles are integrated into this work?
I'm sure Miranda's going to have something to say, and I'm going to cut her off and go first.
You go first and
I-
I'll pick anything you guess.
I get A lot of people reach out to me, ACT therapists, and say, how do I get into this work? And what I want ACT trained therapists listening today to understand is that ACT is excellent training for this. It's 80% of what I do. And the other 20% is understanding the mechanism of action, understanding the subjective effects, understanding what to do if somebody tries to leave the treatment room, right? Sort of the practical realities of that work. But ACT is, I think, uniquely well suited insofar as it does a couple of things. One, we have tools to really practice willingness beforehand in that preparation phase to help people get clarity around values and leverage that as we're moving toward the journey. And then on the back end, after the journey, I think our ability to work with people around values and committed action in the wake of that journey is invaluable, because people have these amazing realizations or these just received truths. It's frequently things like love is the most important thing. That you hear that a lot. There's a reason that it's a cliche. But what do you do with that? As ACT clinicians, I think we have a lens that helps us figure out how to work with clients to put that into practice. Okay, love is the most important thing. How do you want to make that manifest in your life? What do you want to do between now and the next time we meet to show up to that, to show up to love? How do you want to love? What does that look like? And that's just one example. So I think that on the back end, our focus on values and committed action are critical in helping people maintain their benefits. Because what you said before is correct, Shaina. People can have these really cool experiences and they just slip right through their fingers like a dream.
Yeah.
So if we want to maintain it, we have to practice it. We have to build those muscles.
We have to practice it with our hands and our feet and our vocal, our eyeballs. It's just someone right after a powerful psychedelic experience cannot in a million years imagine ever forgetting this. And then they do, right? Maybe not entirely, but in ACT, we have these existing strategies for helping people start integrating this new learning, this new awareness, maybe new willingness, maybe new connection with values into their lives starting today, so that they can support and even grow what they've learned, which is so exciting. One of the things I like about making use of a client's psychedelic experience is often what they experience in the psychedelic trip is something that they have perhaps not experienced in their lives, like willingness to have deep sadness. There's a lot of good crying in people's trips. And to be able to also reference what was it like to just let yourself grieve and feel or move through shame, and to have people talk about what we normally avoid as highly desirable experience. That's something to build on. Maybe I spent my whole life being afraid to feel that. Well, I felt it and I'm okay. In fact, I'm really glad I felt it. How do I keep doing that? So there's the obvious behavioral integration into life. How will you make love important? But also, what will you do on the inside with your internal experience? How will you use this to change how you show up to the hard stuff, the unwanted stuff, the stuff you thought you couldn't have?
Yeah. No, that's beautiful. And I think so powerful, and also makes it just reinforces how important it is, that preparatory work of making sure that the person is positioned not to be entering the psychedelic trip with the expectations of escape, right? That if when it's being used for escapism, that it's really like that intention of being with these experiences and making meaning of them, really squeezing the juice out of them. It sounds like you're doing with them. And that also being able to speak to that pain is often centered in this experience, but in a way that is not intended to be avoided, that it can be like seen, it's powerful, beautiful. But it sounds like when many people are going through their psychedelic trips, they're feeling strong, intense, painful emotions, maybe just having a different relationship with those experiences than they ever have before.
You said it. different relationship. In fact, even when we talk about it as painful experiences, I know the sober listener is thinking, oh, much painful experiences, but there's vitality in life and pain, in being sad over what was lost or what was never had, in being angry, in being ashamed. All of those kind of air quotes painful experiences are part of being human. And it feels good to be human.
I think it like can be a very interesting entry point. Again, giving someone an experience, doing ACT work, it's working people toward willingness and showing up in their lives and having these experiences. It sounds like creating this experience around the experience of the psychedelic trip and then letting that just reveal all these lessons and all of these insights, and that then being a rollout to this deeper work sounds like a really impactful way. And I think when people come to therapy, they're already often long suffering, struggling, feeling stuck and disengaged in their lives. This offering of something tangible that they can have in terms of an experience, I imagine that is also just very motivating and keeps people engaged and gives them that buy-in to be open to having this experience. I would love to hear just what are some of the most profound or surprising therapeutic outcomes you witnessed in your work with MD and psilocybin. It sounds like you have both sort of bore witness to a lot of really interesting experiences. I am really interested to hear if there's anything you've seen that's had a great impact on you or surprised you in doing this work.
So I'll speak generally. I think one of the general uh, experiences that I've had of clients and of participants in trials is a shift in their experience with themselves. I think psychedelics create a very novel context in which people often feel connected. They feel connected to other people, to nature, to the universe, to God, or some spiritual presence. And that sense of connectedness, we see it again and again in the research, that sense of connectedness seems to mediate other enduring change, right? Like reaching out to people, connecting with friends that they'd ghosted a long time ago, or reinvigorating their relationships with their children or their spouses. So that sense of connection is really stunning to see people yearning for that again. And there's research to support why that might be happening. The other piece, though, of that is more of a connection to self. Like I'm connected to everything. I'm part of all of this. And so it can cultivate what someone called the small self. Like I'm small, but in a good way. I'm part of something bigger than myself. And I think what that does is it helps to promote a sense of self-compassion. And when I work with clients, I feel like working with self-compassion is central to what I do. So many of my clients are highly shame-prone, very self-critical, and it's stubborn to work on that. That self-critical voice holds on with a death grip to individuals. And psychedelics, in my experience, can really help loosen that, such that I have had clients who I just thought, "Ugh, we're never going to get to self-compassion. I'm never going to get her to practice this." And then they'll show up in my office and they'll say, "You know what? I just realized, like, yeah, it just wasn't working. Yeah, it didn't make me feel better. So, yeah. So anyway, I'm going to stop doing that." And I am gobsmacked by this. And often this is months after the experience. Change endures. We think that there might be anatomical changes or neurochemical changes in the brain that endure after the medicine has left your system. And I think of it as like these medicines come from plants and fungi, the natural ones, the plant-based medicines. And mushrooms have this rhizomatic growth, this growth that happens beyond outside of our awareness. We can't see it. And I feel like that's what happens for people in the wake of psychedelic experiences. Sometimes even for folks who aren't working particularly hard at integration. That sometimes there is this subterranean change that happens over time. Do you have any specific examples of what Shane is describing.
I know. I want a really good sort of concise example of this. What I'm thinking of, and I've seen different versions of this, so I think I can give kind of a version of it, is it has been really remarkable to watch people have experiences which completely revise their sense of what they are, right? Certainly there's connection to self and others, but lots of people seem to come out of these experiences saying, oh, this reality that we live in, this isn't real, right? These are wavelengths. We are energy, right? We are all this thing that is happening. And it cultivates just the sweetest relaxing around life. This doesn't really exist anyway. We've got to go along with it because it's all we know how to do. But this isn't quite so serious as we thought it was. And I think there's tremendous relief in that. It doesn't mean that people suddenly stop caring about their lives or going to work. They seem to continue to do all the important things, but they feel less spun up in the dire seriousness of this kind of space that we live in. They get some levity. They get an alternative way of looking at the vicissitudes of living, which is just this, I think, ongoing gift.
Yeah, no, I think that's remarkable. And I think in doing ACT work, whether it's working with other clinicians or working with clients, sometimes I think one of the greatest stuck points can be the self as context. And I think what you're describing is this complete dissolving of self as content in that experience, and then really being able to just hold that.
I love what you're describing, because it's like self as context. Like, that's the process that every new ACT therapist is afraid of. It's like, how do I do that? Should I do the chessboard metaphor? Right. And this is one of the things about psychedelics that I think is helpful for clinicians, is that, who was it, Miranda? Was it Jason who said that psychedelics are self as context on steroids, right? It's like
Self as yes, exactly.
Self as context on steroids, right? We have inside of that experience, there's the potential to do a whole lot of perspective taking, a whole lot of experiencing oneself as the container or part of something larger, the sense of self-transcendence that is so important. And so for me, it's always a delight, because it's never been my strongest process. And so I love it when psilocybin can help me organically show people what we're talking about, so that they have this lived, embodied experience of, oh, I'm not who I thought I was. I'm not the stories. The stories are silly. Why did I hold on to them for so long?
Yeah.
Oh, so if you are joining us on YouTube, you may notice we had a quick costume change. We ran into a little bit of technical difficulties, but we're back and we're ready. It's been really wonderful to hear from both from you, just your experience of how transformative this treatment can be for folks. And I know you mentioned that in terms of the clinical trials, that there's a lot of folks that are excluded for a variety of reasons. And in your harm reduction practice, you're maybe thinking about this more broadly, about who's clinically appropriate or who we can work with towards this pathway for treatment. I'm curious, in your experience, what do you see as some of the ethical concerns or contraindications clinicians should be thinking about when considering psychedelic-assisted therapy, or if their clients are interested in psychedelic-assisted therapy?
I think what comes to mind for me first is if the client has health concerns, especially cardiac concerns, because both MDMA and psilocybin and other psychedelics can raise heart rate and blood pressure. So I think that's an important conversation to have with clients, is making sure that their cardiac health is solid and that their blood pressure is under control. In the clinical trials, if blood pressure is controlled, then people are generally free to proceed with the trial. Other concerns are maybe more obvious, like pregnancy. Folks with epilepsy are often screened, just because I don't think we understand the interaction between that neurological condition and these medicines well enough. Also, folks who are actively suicidal or psychotic, we'd want to be really careful. Folks with bipolar 2 or other psychotic disorders among first-degree relatives are often excluded from the trials. And there again, I would be cautious. We don't know if psychedelics can flip people into a psychotic episode. We're actually not seeing that in the clinical trials, and I think it makes sense to be really cautious at this point. I think beyond that, the physical, the psychological concerns that I would keep an eye on is, does this person have adequate support at home? Do they have people that they can lean on? Do they have people they can talk to about this? Sometimes in the trials, we see people who really don't have that support, and they're able to be in the trials anyway, in part because very often severely depressed people have lost contact with the people who are most important to them. Their social support isn't great. And so the stance that some of the sponsors are taking is that it's unethical not to treat them. So we try to support them in other ways, like peer support groups and ensuring that they're connected with a therapist. Miranda, are there things that come to mind for you about, like when we're working with clients in private practice, ethical considerations around who should or should not participate?
No, I think sometimes the ethical considerations become apparent when you get to know the client, what their intentions are. There's some obvious ones that you could intake your way through to rule out, like a first relative with psychotic disorder. But I've had experiences where it's become clear as I got to know someone and what they were looking for, that what they were looking for was a quick fix, and that they were not, yeah, sure, whatever you say, Miranda, but you just prep me so I can go do this. And that to me feels like an ethical consideration, in the same way that we have ethical considerations about informed consent and psychotherapy across the board. I don't want to encourage someone to do something that they think is going to be this magic fix, only to have them experience it as a failure, right? Just as when we're not clear about what therapy offers and people feel like, oh, I'm no good at therapy, or therapy is not for me. I bring the same lens to supporting people as they navigate how to use psychedelics on their own.
Yeah.
I think there's one thing that I would add to that is for folks who are traveling abroad. Very often people travel to South America to participate in ayahuasca ceremonies. And that's a place I feel really strongly about cautioning clients about doing their homework on the kind of retreat that they'll be attending. One, because some retreats are run by people who aren't really shaman and who might take advantage of them. So there's potential danger there. Equally important, ayahuasca tourism has been hugely problematic for Indigenous people in South America. And so I think it's really important to ensure that if you are going to an ayahuasca retreat, to make sure that they are honoring the shaman who are part of this ancient tradition, and that they are ensuring that the money isn't just enriching some American investor, but that they're actually making sure that some of this money is going back to the communities from which these medicines came. And I think that's true for other Indigenous medicines as well, including peyote. But generally speaking, our advice around peyote is don't use it. The active ingredient in peyote is mescaline. And if a person really wanted to use that medicine, the San Pedro cactus, which is available in certain spiritual and religious traditions in South America, that's a way to do it. Peyote isn't considered an endangered species, and a spiritual medicine of Native American peoples who have explicitly asked us to not use them. And I think it's really important to honor that tradition.
Yeah, absolutely. I think those roots in these deep historical, spiritual, and cultural practices are so important to keep in mind, particularly in the context of the tourism that's happening around it, as you mentioned, and not being exploitative or co-opting these cultural practices. In terms of your thoughts about if this increasingly becomes adopted in the U.S. medical community, even when you were talking about your experiences personally and clinically, even if it's not like a specific cultural practice or denominational in some way, the spirituality of how this shows up therapeutically shines through. Is there any risk that you fear of that being lost if it's transitioned into medical practices and healthcare and mental health care more formally?
Yes, we are very concerned about that. And as in ACT, we take an ontological approach and we honor whatever spiritual traditions people might bring to therapy or certainly to psychedelic experience. It's certainly not uncommon for people to have deeply spiritual, mystical experiences on these medicines. Here's the second half of my answer, and here's what I think many of us in the psychedelic space are concerned about, is that what some drug sponsors are trying to do is to remove the psychedelic effects from the medicines, taking the magic out of mushrooms, if you will, so that they can administer these drugs, which are considered psychoplastogens. They make the brain, in theory, more neuroplastic, so that they can administer them in such a way that people don't have a trip. They don't have the journey. And my concern is that what that does is it dilutes it down into an antidepressant. And psychedelics aren't antidepressants. They function in demonstrably different ways. Antidepressants essentially blunt emotion, positive and negative. Psychedelics do the opposite. They are expansive. They amplify emotion and hopefully provide an experience that help us reconnect with emotion, as Miranda said earlier about how feeling is so important and so deeply human. So they function in different ways. And I think it will be a tragedy when this happens. There certainly will be some of these medicines, or they're trying to develop medicines that don't have the psychedelic effects. And we don't know what that looks like. We don't know how much the actual psychedelic experience impacts the long-term effects. What we do know is that mystical experiences do predict enhanced outcome and enhanced benefit. It concerns me that we might try to remove the possibility of that, especially when the people most likely to get that version are the people with the fewest resources, right? Maybe psychedelic journeys would only be for the rich, and maybe the watered down version would be for people who don't have the resources to access that.
Yeah.
And I think that would be a tragedy.
Yeah, absolutely. I know you have been speaking to how important the scaffolding around the experience is and in promoting safety and helping folks uh, get the most meaning out of the experience. And you spoke very candidly that it can be a challenging experience. So, how are you approaching clients that may re-experience trauma or have another sort of deeply challenging experience during a psychedelic session?
I can speak a little bit to
Yeah.
that. Nobody wants that. No one is going into these experiences saying, I would like to recontact my trauma or have a new, novel, challenging experience. And we work very hard up front to communicate that there's tremendous benefit in moving toward being open to whatever shows up. Something that I think we understand in ACT is if you look across sort of diagnostic categories or the nature of different human struggles, almost invariably, in fact, I think I'm going to go with invariably, the suffering is supported, maintained, even exacerbated by efforts to not have painful things. And that is not, she's got some sort of cool ideas about this, but that avoidance, the way that we use it out here in the hopes of managing our suffering, which I think we know it doesn't work, but we try. It doesn't work inside the trip. In fact, it can get people into arguably more uncomfortable places. And so there's a lot of work around being willing to have whatever shows up, even if your mind says, I don't want this or I can't have this. The better people are able to show up to whatever occurs inside of a trip, the better able they are to make use of the experience.
Yes, the cool thing that happens inside of the psychedelic experience, as Miranda was describing, in real life, when we avoid, we get reinforced. We get some relief, we get a buzz, something that keeps us coming back for more avoidance. In the psychedelic experience, it's very different. In the psychedelic experience, if you avoid something uncomfortable, there is a good chance that you will be punished, that the trip will turn into a more challenging experience. So the consequence of avoidance is very different inside of the trip. And we work very hard to explain that to people so that they understand how important it is to practice willingness and acceptance in advance of the trip. How can we do that so that by the time they get there, they have some tools for allowing for whatever shows up? Something else that we like to share with people is that willingness and acceptance tend to be rewarded inside of the trip in a way that they might not be in sober experiences. There tends to be more of an immediate reinforcer inside of the experience when we are willing to move toward the monster and something changes. There's transformation, something unexpected happens. So it's really, for an ACT therapist in particular, it's a really cool proving ground for the concepts that we're inviting our clients to practice.
Yeah, no, it really sounds like that. I know you were both speaking to that thought of it being self as context on steroids. And it also sounds like these 4 ACT concepts of the control agenda and creative hope. It's like a master class in that sort of let's go through the psychological fun house of how all of these things are showing up in your life. I think that's really important as you're talking about understanding someone's readiness when if they're coming in with very rigid willingness to have a certain kind of experience, that it's going to look and feel a certain way, that your ears are perking up about it, exploring that more deeply and preparing them more deeply around how willingness can serve them so well in going through this psychedelic journey. So, yeah, absolutely.
There's one other piece that I would add, which is that when people do revisit trauma, and very often that initial trip is a very autobiographical trip, people are walking back through their lives again. They are recontacting, revisiting really painful material that maybe they've avoided for a long time, and their experience of it is very different. There's more of a sense of, oh, this isn't what I thought. I can talk about this. I didn't know I could talk about this. It's okay to return to this. And I think there is, in some ways, a sense of agency, right? Like in trauma, there is no agency. It's part of the reason it's traumatic. In the psychedelic experience, while we might not feel like we're in control, so to speak, I think people often have this experience of, oh, I can do this. I can come back to it. I didn't know that I could revisit this and be okay and understand it from different perspectives. Very often that's what's happening. There's flexible perspective taking happening inside of that experience. And I think that's part of what makes it okay, that makes people willing to engage in that re-exploration.
Yeah. I love that. And I think like positioning that like agency and control aren't like in polar oppositions, that you can be in an experience where there is limited control and still have personal agency. I could see how that being so powerful for a trauma survivor to go through that experience and kind of walk out feeling more empowered for as a result. I know we were talking about where this goes in some of the fears, some of the concerns about what the future of this looks like in terms of what is sacred to preserve in this experience for it to be experienced fully. But what are your thoughts about how psychedelic assisted therapy may evolve in 5 to 10 years? We're in a transitional period for sure right now in the United States. I think a lot of things are up in the air, whether it comes to research or the embracing or rejection of psychedelic assisted therapies. What has been coming up for both of you in thinking forward?
Well, I think most recently what we saw is that MDMA, the application for MDMA-assisted psychotherapy, the new drug application, was rejected by the FDA. And that came as a blow to the psychedelics community. A lot of people did not see that coming. People were very optimistic because the research was so strong. And I think it was, at the end of the day, a cautionary tale for the psychedelics community to pay attention to what's working in terms of moving these applications through the process so that hopefully they can gain FDA approval, in which case they would then go to the DEA, and the DEA would have the flexibility to reschedule these medicines, making them accessible for prescription. So we don't know what's going to happen with MDMA. We don't know why the FDA rejected that new drug application. Only MAPS and Lykos have the answer to that. It looks like the next medicine that will be part of the new drug application will be psilocybin. Compass Pathways will be making an application probably in the next few years. And here again, we don't know what this looks like in terms of federal rescheduling. We're not as optimistic as we used to be. Having said that, I think that as much as we can pair these medicines with evidence-based therapies, the better. Therapies like ACT that are grounded in the science, that have a tested, rigorous, cohesive understanding of human behavior, paired with the sort of the woo of psychedelics, I think all the better if we can do that. And I think it's more likely to happen at the state level. It's already happened in Oregon, right? Psilocybin is now available in licensed service centers with trained facilitators. And I don't know what the rollout's going to look like in Colorado, but I think it will be similar. I know Colorado's trying to improve on Oregon's system. So that remains to be seen. But I do think that there are folks working at state and local levels to circumvent the federal system, because it is so difficult to get drugs moved from Schedule 1 to a more accessible schedule.
Yeah, absolutely. So, what advice would you have for mental health professionals interested in getting involved in psychedelic assisted therapy?
The first thing that comes to mind is for people to do their research around what's available in their areas in terms of, say, working for clinical trials and local trainings. There are certainly big training companies, Fluence, IPI, California Institute for Integral Studies, all well-established, reputed companies. And those trainings are expensive and they're long, they're time intensive. And at the end of the day, you can take one of these and you don't know if you're ever going to be able to use that training and knowledge. So it's risky to do those trainings, I think. Especially because, let's say I'm in Maryland. If Maryland were to say, okay, we're going to follow Oregon's example, it might be that the training that I took doesn't grandfather in here, and I might have to take another training in order to qualify to be a facilitator here. So I would be cautious in that regard. Having said that, there's lots available online, and I think self-study is a really good place to begin. There's one protocol in particular called the Embark protocol that was developed by Cybin, which is one of the psilocybin drug sponsors, one of the more prominent ones. And they've made it open access. And I included it, Shaina, in links that I'll send you to put in the notes. So this is the Embark training. It's a good, solid training. And it would be a good place to dip your toe in and decide, am I really interested in learning this? It's a lot of information. It's also a nice thing to have on your resume if you decide that you want to apply to work in a clinical trial. So it's a good first step. Miranda, would you add anything to that?
I would say that the opportunities for self-led study are vast. And that I think the importance of familiarizing yourself, not only with what's happening now in this wave of psychedelics research, but what happened in the last century, critically important. There is such a rich and, by the way, unbelievably interesting history here around how psychedelics have been used, how psychedelics have been misused. And I think as someone who's come a little bit late to this relative to, say, Temple and some of my other prospective colleagues, getting a footing in that has felt very important. And then you can layer on top of that, depending on, as a psychotherapist, what your interest is, right? And understanding the neurobiology, the mechanisms of action, what to expect from a client who is using psychedelics. A lot of self-led study is, I think, will get you answers to lots of those questions. And then, of course, there are these training programs like Embark, which are just invaluable because they've essentialized it and boiled it all down for those of us who maybe get a little overwhelmed.
Yeah, absolutely. Thank you for such an amazing conversation. You're both so knowledgeable and so passionate, and that really comes through. So where can our listeners learn more about your work and stay updated on the latest developments in psychedelic assisted therapy?
What comes to mind, especially because so many of your listeners are ACBS people, one place to look is Portland Psychotherapy. They do a series of trainings on psychedelics and self as context, psychedelics, and the law. That's a helpful one. Brian Plecki and Jason Looma do quite a bit on that. So they're a great resource. And they are running clinical studies at Portland Psychotherapy from an app lens, which is about the coolest thing I can imagine.
And didn't they just have PIPS?
Thank you, Miranda. Yeah, I did actually include a link to PIPS, which is the Portland Institute for Psychedelic Studies. So they're going to expand their research and their clinical services. So they're a great place to begin. I've also linked to Perspective Retreats, which is our team. So that's another place to, especially if folks would like some experiential training. I think we're a place to start, and we're happy to answer questions or have informational interviews with people if they're curious or want to learn more. In addition to that, I've shared some links to Johns Hopkins Psychedelic Research Center, Yale, Psychedelic Support, Arrowhead, and a few other folks to get people started. And then they can fall down the rabbit hole like I did and find all the other resources that are out there. But I think those are all good starting places.
And really, I don't want to speak for Temple, but I will anyway. People can also reach out to us. People reach out to me all the time to find out what training is coming up. Our group, True North, has an ongoing CE series, and we try to devote a portion of that to psychedelics, psychedelic psychotherapy. Temple has a psychedelics and ethics course, which we offer periodically. That's a fun way to get your ethics CEs.
That sounds like
Much less scary than are you HIPAA compliant?
I think it's sexier than HIPAA compliant.
Oh yeah. Oh yeah. No competition there.
Yeah. We also actually Brian Plecki and I do a 6-hour ACT and psychedelics training, which we're going to do in person in Maryland, right outside of DC on March 14th. Yeah. But that's probably not accessible for most of your listeners. We will do an online version soon, and and that'll be through True North Therapy and Training. So we have an events page where we post those trainings.
And I think you may have mentioned it, I'm not sure, Perspective, we do run annual retreats, and we've got a couple coming up in August. So if people are interested in learning more about that, they can look at the website. Again, they can contact us directly. It's really fun to talk about this stuff. And I like spreading the good word.
Yes. I feel quite certain that this conversation is going to ignite in many of our listeners falling down the rabbit hole right behind you. Really phenomenal stuff. And thank you both so much for your time.
Thank you so much for having us. It's been such a pleasure talking with you today.
Yeah. All right. Thanks.